Sexual offenses are defined as the act of sexual characteristics without the consent of the victim. Whenever they are performed without the consent, they are regarded as the sexual offenses and they have their own legal importance. Now, deaths can be associated to all of these unnatural sexual offenses and even the natural sexual offenses if they are performed without the consent of the victim, of course. The victims are usually the females, and the males are sometimes victimized, but they are of a lesser percentage and they are not reported that oftenly. Even the minors can be reported to these sexual offenses, and we have to basically categorize to which age the person can give a consent to a sexual act. That is very important. It is different for different countries, and it basically goes under the law of that country in which country you're performing the investigations. Now, in this section, basically, we'll be dealing whenever we get a victim at our hands, how are we going to perform the external examination of the victim in detail, of course. Of course, the examination of the assailant, if found, is also of critical importance, but the victim is of a mainstay over here. How are we going to examine the victim who has reported such sexual offense against him? Then the mouth and the lips are going to be examined in detail, and any findings, for example, even slight bruises or any pressure marks, abrasions, lacerations are going to be noted down over here. Then we are going to basically get our attention on the bite marks. Bite marks are going to be noted down and they have their own trace. Even the trace evidence can be found in these bite marks, so they have their own significance over here. The bite marks, I'll be basically discussing that in detail later on, and we'll go through them one by one. So the examination of the living victims of the sexual assault is very important. Even in this diagram, you can see the pressure marks. It can be the hand marks of the assailant, and we have to basically observe these marks in detail. These can be the bruises, these can be abrasions, and even these can be lacerations of some sort. So they have to be documented in detail. Obviously, the documentation includes their location and their severity. We have to comment on both of them. Now, the deaths due to the sexual assaults, what are the findings? What are the usual findings of the victim? They have the pressure marks on the neck, the head injuries, or even the stabbing is very common. For example, if there is a sexual assault, the stabbing would be related to the sex-related organs. For example, even the breast and the pelvic regions are going to be stabbed in detail. And then the pelvic trauma is very important. Pelvic trauma can be even of a major fatal kind in all of these sexual offenses. Now, the external findings in the fatal sexual assault is very important. We have to be very meticulous whenever we are documenting such a case, because it is going to be there in a documented detail and it has its legal significance. The external examination is very important, and we have to do that very carefully before we start off with the internal dissection if the autopsy is performed. If in a living person, of course, the external examination is the only examination that is going to be carried out. So the study of the body surface, similar in both living and dead, is important. Obviously, in the living person, we're not going to perform any internal examination. Apart from the vulva and the vagina, we can perform certain kind of an internal examination in that portion. And the general appearances are going to be noted. The clothing is very important. The clothing of the person, the mental state of the person. For example, the post-traumatic stress disorder in the rape victims is very important. And we have to basically calculate the mental state of the person. As I was emphasizing, even the minors are subjected to these kind of sexual assaults. So we have to keep in our mind the mental state of the victim, and then we are going to comment upon the general appearance of the victim. Then the perineum is the second point that we are going to discuss in detail. That is basically the perineal region. The pelvic region is very important. Perineum basically includes the external genitalia of the person. So we are going to comment upon the vulva, the pubic hair, and even the introitus and the hymen of the individual. We are going to basically comment upon the marital status and if the sexual act is performed for the first time in a virgin victim and in a non-virgin victim. It's basically two different kind of examinations, and they're carried out in detail accordingly. So, as I was emphasizing, the external examination is very important, and here the mouth and the lips are very of much significance. So, we are going to discuss the bruises on the lips and the inside of the buccal surface. The buccal surfaces are again very important, and even we are going to perform the buccal swabs. The buccal swabs are even the dry swabs are taken, and the wet swabs with the alcohol are taken for any signs of semen analysis if the oral penetration is over there. So we'll basically comment upon if there are any signs of semen presence in the oral cavity. The petechial hemorrhages, basically they are going to emphasize upon the pressure marks. If the pressure was applied to these area of the mouth and the lips, then the petechial hemorrhages are going to be present on the mucosa of the soft palate, and that we have to comment upon over here. Even different types of trauma can be found to these areas. For example, abrasions, lacerations on the buccal surface are found. Even in the mouth and even on the inner surface of the buccal cavity. Swabs should be taken, as I was emphasizing, for the detection of the seminal fluid, and the seminal fluid again is going to basically refer to the DNA of the assailant. The analytical methods to detect the seminal fluid or the male epithelial cells is again going to correspond to the detection and the identification of the assailant. So that is very important, and these analytical methods are the mainstay whenever we are going to send the samples to the chemical pathologist for further details. Now the bite marks. So bite marks are basically, this diagram is basically emphasizing the different type of bite marks and what are basically the teeth relating to these bite marks. So this is basically a rough diagram. It is showing the left lower canine. It is showing the left lateral incisor, and the lower right central incisor is shown over here. And over here we can see the other teeth. For example, these can be the drag marks from the upper incisor teeth. So it is not going to be a very well furnished photo whenever we are going to relate to the bite marks, but we are going to get to see the drag marks even, and some different petechial hemorrhages, for example, they can be seen over here. So all these bite marks are going to be studied in detail. The drag marks from the upper right first premolar touch are lying over here. So the bruises on the neck, the shoulder, the breast, and the buttocks. So these are basically the act of the sex is basically going to be highlighted over here. And we are going to note any kind of bruises, even the abrasions or lacerations can be noted down if found on these regions. They're generally known as the love bites and the minor lesions to mutilating the bites of a sadistic nature. So it is also going to put some light on the assailant's mental status. For example, maybe he's suffering from certain kind of sexual perversions. So even that is going to be highlighted over here if he is of a sadistic nature or not. The suction lesions, of course, as we were referring to, they are basically, what are the characteristics? They are circular or oval areas of the bruising. And there are many small intradermal petechial hemorrhages, and these petechial hemorrhages, the locations are again going to be of the same kind, that is the neck and the breast and the pelvic regions, of course. Now the semilunar marks at the periphery from the lips is again going to basically relate to these suction lesions, or they are also known as the bite marks. The teeth indentations or abrasions are basically, we are going to comment upon which teeth indentation it is, and if there are, we are going to comment upon if there are any drag marks or not. Now, on sides of the neck, below the ears, upper shoulder, breasts, and around the nipples, these are the regions we are going to focus upon whenever there is an act of a sexual kind. And of course, if there is a if this is a non-consent act, only then the sadistic involvement is going to be there. For example, the bite marks and the abrasions and the lacerations. Now, it may accompany suction marks or even it can be independent, of course. Maybe there are some other lesions along with these bite marks, and maybe they are of the isolated kind. The abrasions or the bruises may match the dental arches of the assailant. If we have a suspect over there, we can match the dental arches of the suspect and the bite marks. The linear teeth, if they are scraped down the skin in the closing jaw, they can relate to the assailant's jaw, and that is going to basically add on to the evidence that we can find on the victim. The superficial or deep enough to penetrate the skin as laceration. If they're deep enough, then they're going to cause the lacerations. And if they're just superficial, that means that it is going to just cause bruises, or they can be of an abrasion kind. Nipples and parts of the areola may even be partly or wholly amputated in such cases. So if they are found in such states, they have to be documented in detail. So in this section, basically, we dealt with if we have a victim at our hand and if he's complaining of any sexual offense against him, how are we going to basically examine such a person on external level, and what is its significance? That is very important. So that is the end to this section. Thank you for watching sqadia.com.